Okay, so I'll give you a clinical recommendation, and you, of course, can take this with a grain of salt because this is, opinion. And one of the keys for me is that each nursery has to develop their own protocol and be comfortable with that so that everybody's on the same page. But I do believe that humidity should be used for infants less than 30 weeks gestation, and certainly during the first week, and I would say the first 2 weeks of life, predominantly because these babies have huge water losses from the lungs and from their skin. And it does help us maintain a more normal, stable temperature and normal, stable sodium balance. Our nursery protocol is to start at 75% humidity and then work it down slowly over 2 weeks and then come off. And we actually have a protocol for that. I think it's important to have a protocol so that everyone's on the same page, particularly because as you're managing the fluid and electrolyte, you should be used to that particular nursery's environment. I would also say that as you visit other areas, particularly other countries, there's marked variability. So Europe uses a lot of humidity. Japan I've seen use 100% humidity with lots of rain out. We're not comfortable with rain out here in this country. I'm not quite sure why that is, but there are some probably good reasons. But when I talked to the Japanese neonatologists, they sort of thought that I was, wrong. And made it very clear. So there are lots of different opinions. I think there should be a consideration. That's my point, is that a consideration in your protocol should be humidification and when to use it. My suggestion is less than 30 weeks and for about 2 weeks. And as the infant's temperature becomes too high, we will alter sometimes the humidity, which will dramatically impact the temperature. So you may not have to change the temperature of the incubator. You could really change the humidity of the incubator. And that should also be part of your protocol. When the baby gets cold and they move out of that neutral thermal environment, they will have symptoms that are pretty general. So they may have symptoms of changes in their skin, so they'll get mottled or constricted blood vessels, and that can look like a bluer baby, a less stable baby. Babies may have problems with vital signs, so they may be breathing abnormally, may have apnea, bradycardia, etc. And these are very generic signs of illness in a baby. It could be due to lots of things, such as sepsis. So you have to consider that thermoregulation and their temperature may be the issue. It may be the only issue. And it's something that you have to really consider as you approach a sick baby. Many babies, I suspect, have ended up on antibiotics when they really were just not well managed in terms of a thermoneutral environment. So this is a vital sign that's important to measure. It's a consideration that has to be there, and it's not. We often just don't think about it, and so I think that this has to come back into as a major vital sign, and if we miss this, we could move the baby onto a cascade of events that may be unnecessary, antibiotics, change in ventilation, etc. And so maybe number one has to be, is the baby's temperature normal or abnormal?